Next up, I am going to be talking to Kerin O'Day and Phillip Baker, and we're going to be talking about the role and power of youth. So time won't allow me to give you the amazing bios of these people, but I'll give you a brief rundown. So Kerin O'Day is a professor of nutrition and public health, and she has focused her career on Indigenous health and is considered to be quite a legend in this space. So Phillip Baker is currently doing his postdoctoral fellow at the Research School of Population Health at ANU, and he has focused his research on NCDs in Asia, just like Shushmita. So he is the former executive director of the Young Professionals Chronic Disease Network, and while he was there, he has helped establish the NCD Action Network, which he'll tell us a little bit more about later. So first off, we'll just start by if you guys want to talk a little bit about why you're passionate about NCDs.
Yeah, sure. Well, first up, Shushmita just outlines the main reason I'm passionate about NCDs, and that is that NCDs have a human face. They affect people in poor countries as much as they affect, or even more so than they affect people in rich countries. And that really challenges the view that it only affects rich and old people. So that's number one. Number two is NCDs for me represent how we choose to organise the societies that we live in. And for me, they are a deeply political problem. It calls into question questions like, do we choose to prioritise the health of the people over the profits of the tobacco, alcohol, and junk food industries? It seems like such a simple question or such a simple answer, but it's not a simple answer. Yeah. We're seeing it right now with Obamacare in the United States and the government freeze-out. Do we choose to prioritise free healthcare for all people, not just in the US, but all around the world, or just provide healthcare for those who can afford it? The answer seems pretty simple. But those are the reasons why I'm passionate.
Great. Kerin, what about you?
Well, I've worked in Aboriginal health now for more than 30 years, and that actually is the period over which NCDs have rocketed in Australia, and particularly in that disadvantaged community. And what we see, absolutely, is NCDs affect the most disadvantaged even in affluent countries, or particularly in affluent countries. There wouldn't be too many people probably in this audience that are obese and suffering from type 2 diabetes. But in the western suburbs of Melbourne and the northern suburbs of Melbourne and the remote parts of Australia, there are many, many people. So, and it's getting worse. And so I think that's why I'm passionate about it. We can't just look at the problem and do small interventions. We have to think about system change. And they are the big questions. We really have to think about a system of government where we have a focus on public good, not vested interests. And what happens in our country now, and increasingly I think over these last 30 years, is that vested interests drive what happens.
Great. So that's what we're trying to bring together tonight, not just health professionals, but people from all different areas of life. So we have hundreds of young people here tonight, people at all different stages of their career. Why do you think young people are so critical to this NCD-free movement?
Well, first up, NCDs are going to be around for a long time. This is a problem with a 30 to 50 year horizon. Okay, so we need to be very smart about making investments now that will pay dividends for decades to come. And in that sense, young people are absolutely key. This is a sort of problem, it's like climate change. It's going to take concerted leadership, not just in the health sector. This is a really important point. It's going to take leadership in the private sector. It's going to take leadership from within government. It's going to take leadership from within advocacy. So leadership's going to be key. Number two is young people today are more connected than they ever have been in history. We can use technologies. We are native to technologies that allow us to connect at a global scale. We can connect across borders. And that for me is key. We can mobilize people in ways using these technologies like we have never mobilized before.
Yeah.
And young people are prepared to connect, not only through social media and around the world, but also across disciplines. And today I know in the audience, and some of those who are speaking, come from much different disciplines to public health. There are architects, there are lawyers, there are economists, there are future political leaders in the audience. And these are the type of people that we must engage with.
Kerin, what do you think about the future youth?
Our generation hasn't done very well, have they? And I think that's really, it's a great source of shame for me and for many of my colleagues. But so it is up to young people. And I look back, to when I was your age and had a great deal of hope for the future, the 60s and early 70s, and I think we need to find that again. And as you say, we must have the leadership among the younger generation, because you've got to live with the world that we have made. And I think I think there's only one way forward.
Great. So a bit of a segue to the NCD action, which we mentioned before. Phillip, did you want to elaborate on what NCD action is?
I'd love to. And this is a shameless plug because, conflict of interest. I've been heavily involved with the network. But check it out, ncdaction.org. If you're looking to do something after tonight, if you've been inspired in any way, please sign up at www.ncdaction.org. And the story goes like this. It's pretty simple. In 2010, a group of us from a range of different countries were sitting around and we started talking about NCDs. And we realized that no one was really doing anything about it. We realized people thought that our generation didn't care about NCDs. And there was constantly this idea out there that NCDs result from, blaming the individual. They're the fault of individuals, rather than reflecting these broader social, economic, and political changes in the world. And so we set up the platform to challenge that. And the central purpose is to create a social movement. So this is about collective action. The website, our group, provides a platform for people from 85 different countries to share their ideas, to share their passions, to share their expertise, and to connect with other people from around the world to take action on this problem, whether that's action at the global level, like NCD Free, or action at the local level. And there are some fantastic examples of people taking action at the local level on the ground. So I please welcome everyone here to sign up.
Sounds good. So we've touched on it a little bit, but just really concisely, what does the future hold for the NCD movement?
Well, I think actually we haven't been a complete failure. But we in the past, we've had some wonderful successes. And I think here in Australia, what we've done with smoking and tobacco, big tobacco, we've been world leaders. I think that there's no question about that. Still a problem, but that's great. We've also done fantastic things with road trauma. But you know what has underpinned both of those things has been regulation. It has been the courage of governments to do something. And that is what we need now. I feel our governments have lost their nerve in things like this. And I think it does come back to who is running our world. And so we do need to try and pull back the power to the people, really. And that would be my message.
Any last words, Phil?
Absolutely. We need more NCD-free campaigns, number one. So we need more campaigns, we need more action by young people reframing this problem. This is, NCDs suffer from a major branding issue. And we need to keep flipping the problem on its head. What I really admire about this campaign is that it frames the problem in terms of opportunity. It's not just about the doom and gloom, death, disaster that you hear from the typical, mostly government-run fair campaigns around the issue. If we can frame this as an opportunity to build and live in healthier cities, to have nourishing food systems, to have healthy, responsible drinking cultures, these have immense benefits, not just in the public health sector, but right across our society. So that's key. What we need to do to achieve that is to take collective action, and Kerin has articulated that very well. It needs to be people power over the power of vested interests. We need to act collectively on this. We have an opportunity to mobilise people from a diversity of different sectors right across society, not just in the health sector, and we hope to do that and continue this movement forward. So,
awesome. Well, it's been so great to have you guys here with us tonight.
Thanks.
Thank you.